I share that because of how incredibly burdensome sickle cell can be. And I don't wish that for anyone. And so even from what I knew of the bone marrow transplant process, my fear and my worry was I don't want to do anything that will impose the pain I remotely experience on someone I love. Hey, Sickle family, I'm Wunmi Bakare.
I'm Christelle Solomon, and we would like to welcome you to the Through the Genes podcast,
where we talk about living,
healing,
recovering,
and exploring transformative therapies for sickle cell disease.
We will also talk about our individual journeys and the bond that we have built as sickle cell sisters. Hey everyone, welcome back to season 2 of the Through the Genes podcast, where we talk about real, unfiltered conversations about sickle cell disease, advocacy, and cutting-edge treatments. I am one of your gracious hosts, Wunmi Bakare, and I have my fantastic co-host,
Christelle Solomon. Nice to see y'all.
Of course. And today we're diving into the donor's perspective. If you're curious about what it's like to donate stem cells and the impact of that choice on both the donor and the recipient, then this is the episode for you. Now, today's guest is someone that I am in absolute awe of, and I will be completely transparent. I love a foreigner because I am a foreigner myself, and we know firsthand how much sickle cell disease impacts patients and their communities globally. So, Dr. Akshay Sharma is here with us today. Welcome to the show. So fantastic to have you. Do you want to give a little bit of an intro for those who don't know you in this space?
Thank you, Wunmi and Christelle. This is such an honor to be here. And thank you for introducing me as an immigrant. That's how I identify, as always. So I'm a pediatric bone marrow transplant physician at St. Jude Children's Research Hospital in Memphis, Tennessee. I trained as a pediatric hematologist and a bone marrow transplant physician, and I take care of children with all sorts of blood diseases. But my research interests lie in advancing gene and cell therapy, including bone marrow transplant for patients who have sickle cell disease.
We are incredibly excited to have not only Dr. Sharma's perspective, but also the lived experience of my older brother and my donor. And I always say now, post-transplant, my pseudo-twin, since his cells are floating through my body, Dapo Bakare. And so I want to really shift gears and talk about the medical process, Dr. Sharma. You are a transplant specialist. You see patients from the very start to the very end. And I would like you to help us understand the HLA screening process for patients who aren't well educated on kind of the medical steps in the transplant process. Can you give us a little bit of a teachable moment?
Sure, Wunmi. From the time that we have started to do transplants, we have tried to find out who the best donor is. And in order to find out who the best donor is for somebody, one of the things that we realized early on is that there are some genes which are sort of like our identity card for the cells. So when two cells, they see each other, especially if an immune cell is seeing another cell, the immune cell asks the other cell, hey, show me your identity card. And if it recognizes that identity card, it says, all right, you are good to be here. You can stay here. But if it doesn't recognize that identity card, it tells you, all right, you're not supposed to be here. I'm going to kill you. And this system evolved because our bodies are designed to protect us from infections. So when our immune system encounters, let's say, a bacteria, and the immune cell asks that bacteria, show me your identity card, the immune cell recognizes that cell, that bacteria, is not supposed to be there and kills it. And so when we are doing a transplant, we are essentially taking cells from one person and putting them in another person. And so the two immune systems now need to recognize and reconcile each other. The donor's immune system has to recognize the host, and the host immune system has to recognize the donor, and they have to nicely live with each other. In order to do that, they have to be able to recognize each other's identity cards. And one way for us to match those identity cards is by a process called HLA typing. Now, these days, there are genetic methods that we use for HLA typing. We can look down to the very genes which code for proteins that form this identity card. And by looking at those genes, we can identify whether two people are similar or dissimilar from each other. And we want the donor and the host to be as similar as possible. Now, as you know, we get one copy of our chromosome from each one of our parents. So one from our mom, one from our dad, and so do our siblings, right? And so if there are two available copies in the father and two available copies in the mom, and we are going to get one each from all of them, there is a 25% chance, 1 in 4 chance, that one of our siblings will be a full match to us, that they have inherited the same copy from our dad and from our mom that we have. So I generally tell them, if you have 4 brothers or sisters, one of them may be a match to you. But that's not always true, because this is a completely random process, but that's the statistical chance. In addition to matching at the HLA typing, we also have to know what the sickle cell status of the potential donor is, because as you can imagine, the donor should not have sickle cell disease, right? What's the point of transferring those cells? They can have sickle cell trait though. So there is a 50-50 chance that one of your siblings will have sickle cell trait, and a 1 in 4, 25% chance that they don't have either sickle cell disease or sickle cell trait. So when you whittle it down, there is about a 15% chance that one of your siblings will be a full match to you and will not have sickle cell disease. Now, this goes as far as siblings are concerned. We can also try and identify donors in the bone marrow transplant registry. So there are people around the world who have volunteered and said, hey, if anybody wants a bone marrow transplant, needs a bone marrow transplant, and I am a match to them, call me. I'll donate. And so I registered for the bone marrow transplant registry now almost 20 years ago. And so that process involves either a cheek swab or a blood draw, and that's sent to the registry. They do the same type of sequencing that's done these days. They look at the genes and they annotate them and they put it in the registry that, okay, this person, Akshay Sharma, this is their HLA typing. And then if you or anybody else needs a transplant and you go to a transplant center, the transplant coordinators over there, they can run a search. They can use your typing and try to match it to somebody in the registry. And if you find a match, the coordinators can then request that donor to donate for you. So that's sort of how HLA typing works. It's sort of every person having a cellular identity card for themselves, which is coded on their genes.
I have a follow-up question to that. For the HLA typing process, what percentage of a match between siblings is there a likelihood of the process being successful?
Yeah, that's a good question. So if you'd asked this question about 15 years ago, I would say we need to have a full match, that your genes have to completely match your siblings' genes in order for us to do a transplant. But in the last 15 or 20 years or so, transplant has changed a lot. We can now have methods to do bone marrow transplants or hematopoietic stem cell transplant using what we call mismatched donors or partially matched donors or half matched donors. These donors are called haploidentical. Haplo means half, identical means identical. So half matched donors. And so now there are methods that have been developed wherein we can use half matched donors to also do transplant. The reason we like fully matched donors is because some of the immunological complications such as graft versus host disease, graft rejection, they are less when you use somebody who's a full match to you. The risk of those rejections is definitely higher when those complications like graft versus host disease and rejection is higher when you're using a partially matched or a mismatched donor. But these days we have developed transplant methods which allow us to do transplants from mismatched related donors and still have a relatively high level of safety and efficacy.
Wow, thank you for sort of demystifying the process. I feel like we say the words sometimes, but there's no comprehension of like what it all entails. So I thank you for that very clear explanation on the science and also the practical steps of how do you find out if someone you're related to or unrelated to is a match for you. I'd love for you to explain a little bit more. So after you've identified someone as a match, what happens next? What are the next steps for the donor?
This process is slightly different when you have a related donor who you know, who's a family member, or if it's an unrelated donor. So let me start with the related donor first. Generally what happens is Let's say you go to a transplant center. The first thing that they will do is they will ask, okay, let's go and check all your family members. So all your full brothers and sisters, your parents, let's go and do HLA typing on them. And that process takes about 1 to 2 weeks. And during those 1 to 2 weeks, they will basically draw blood from you. They will draw blood from all the family members, and they'll send it to a lab that'll do the HLA typing process, right? And in 1 or 2 weeks, you'll get those results back and you'll know if one of your brothers or sisters is a full match to you or not. If they are a full match, voila, you're good. They can serve as a donor for you, and the next step will start. Let's take a detour and talk about what happens when you need an unrelated donor. When you need an unrelated donor, the first thing will be you go to a transplant center. They will still check your brothers and sisters and make sure they can identify a match. In this situation, you probably didn't find a match. That's why you're looking for an unrelated donor. So then they'll take your HLA typing and they'll put it in a system which sort of works like Google search, but it's a dedicated system which only searches for the HLA typing that donors have volunteered for. So it'll search your HLA against the HLA of millions of donors in the registry, and it'll generate a list that these people are full match, these people are partial match. Then your transplant physician can sort through that list and identify, okay, well, these people here in this list, there are a number of different things other than HLA typing that we look for. Things like age, things like sex of the donor and how that is similar or dissimilar to your own sex. Infection, particularly CMV infection history, pregnancies that the donors might have had before, because all of these things will affect the stem cells that we collect from them. And so we will go through all of these factors and figure out, okay, these 4 or 5 donors are the best, and I would like to request them. And so then I go to my coordinators, and they do all this magic behind the scenes, by the way. The transplant physicians, yeah, they play a role in this, but I have to tell you, there is a whole team of people who help me do what I do. And I couldn't do this thing without the help of all the transplant coordinators that I have. They are amazing, and they make my work so much easier. Their work is like magic.
I love that you share that in this transplant process, you're like the lead actor and everyone else is like your co-star, because with any film or any piece of media, if you don't have your supporting cast, then your work is not going to be done at a high level. But in kind of speaking about this, one of the things that I know my brother experienced personally was managing expectations. For him, he was willing, forever grateful, he was willing because he had a front row seat to all of my worst vaso-occlusive crises across 3 to 4 continents. So it made sense for him to want to donate. But when he had the initial conversation with the team, they didn't share how much the apheresis process was going to impact his physical health and some of the other symptoms that he experienced. So how do you manage expectations of donors? Because in your case, you are a pediatric hematologist, so you are dealing with a very vulnerable group, children. And I also recognize that every family is uniquely different. There are some families like mine where my brother was older, he was in his 30s, so he was more informed about what he was signing on for. But you have some patients that their donor is a year old, 2 years old. They're not in a position to be able to consent to this rigorous process. How do you manage those expectations for specifically pediatric patients?
Absolutely. Yeah. This is a process, right? And so as far as possible, we try to pick donors that are at least 18 years of age or older. And so if, let's say, you had 2 siblings and both of them were a full match to you, we would pick the one who is over 18. So if somebody was 21 and somebody was 16, we would automatically say, hey, let's go with the 21-year-old, because they can understand what is going to happen to them. We can talk to them. I mean, of course, we can talk to the 16-year-old too. And I'm sure the 16-year-old will be just as happy to donate for you. But there is something to be said about age of maturity and being able to make an informed decision for yourself rather than somebody else making a decision for you. And so whenever we have multiple donors, and if one of them is a major, another one is a minor, we will go with the major donor. Now, one of the things that we do for all our donors is, and I think that's true for all other transplant centers as well, if we have a related donor we always make sure that the related donor gets to talk to an independent physician who is not the physician for you as a patient. So if I am taking care of you, I wouldn't talk to your potential donor. I will have one of my colleagues talk to your potential donor, because, I mean, we are all invested in the care of our patients. I want to make sure that you get better. And so even though I'm not trying to be biased, I'm not trying to unduly influence your donor, it may just come out that way. I may say things which might make the donor feel guilty that, hey, I have to do this. If I don't do this, I'm a bad person. So we try to eliminate that or reduce that feeling of guilt and bias as much as possible. So one of the things that we make sure is that our donors get to talk to an independent physician who's not related to the patient who is undergoing transplant. That's number one. Likewise, as I just mentioned, the donors go through their own physical exam and own blood work and stuff, which is performed by an independent physician as well, to make sure that there are multiple people who are looking at that person to be a donor and say, yes, this is fine, this is good, you should do that. As far as pediatric donors are concerned, we also have them meet with our child life specialists. Child life is a whole department within most pediatric hospitals, and those people are wonderful as well. They are angels, they are saints. They explain all these activities to pediatric patients and donors in an age-appropriate language.
I often say that even though I wish the transplant was offered to me at an earlier time point, like no one had talked to me about transplant as an option. I often say that I know God's timing was perfect, and that Lord knows I probably would not have understood all that I was going through, and I might not have wanted to get a port or take all my medications, and understanding that everything matters in this process. And if you veer off the process, it can impact the success of the transplant. And, my siblings would have been much younger, and them understanding the role that they're playing in my health. And so I think about that time frame, and I'm like, if I was a child, like both of us were children thinking about this, it's so big. But I'm so happy to hear that there is a process in place to really bring the patients with you, as opposed to just the parents or just the donor who's an adult. So that's very encouraging to hear. And when I was embarking on the transplant process with my brother, I didn't even know until we got to that point that there were multiple ways of collecting stem cells. I thought everything had to be harvested from the bone. So can you explain to us the difference between harvesting stem cells directly from the bone, which is what a lot of people think a stem cell collection is like the only option? And then can you also explain apheresis, which is a different way of collecting the stem cells?
Sure. Yeah. So you're right. Bone marrow harvest has traditionally been the more common method. These blood-forming stem cells, they live inside tiny spaces inside our bones. And so the most direct way of getting them out is you basically put a needle in the bone and you attach it to a syringe and you suck it out and collect it in a bag. Yeah, it's pretty painful. And so for that reason, this process is done under anesthesia. So the donor will be put to sleep in an operating room. And what we end up doing is we generally harvest bone marrow from the hip bone. So the donor will be lying on their belly, face down. And then two people, usually two transplant physicians or advanced practice providers, they will start on either side of the patient, left and right. And simultaneously, they will put needles into the hip bone, into the back, and then suck out 5-10 ml each time. And usually it involves, depending upon how much volume of marrow we are collecting, it could involve anywhere from 30 to 100 needles being put. It does not involve 30 to 100 needles going through the skin. What we do is we make one hole in the skin and then we keep moving the needle around in the bone. But in the bone, there could be 30, 50, 60 holes. And when the donor wakes up, they're going to be a little sore in their back for a couple of days. So that's the bone marrow harvest. Apheresis is slightly different. So in apheresis, first thing that we do is to mobilize the stem cells. So as I told you, stem cells live inside these tiny little spaces in the bones. By giving certain medications, we can make them come out of these tiny spaces. We can have these stem cells come out into the blood, and then we can filter them out of the blood. So we first give our donors a medication which causes the stem cells to come out into the bloodstream. Then we connect them to a machine, which looks very similar to the red blood cell exchange machine that you might be familiar with. And so what happens is we connect them to a machine with two large IVs, usually one in each arm. And so blood comes out of one arm, goes into the machine spins the blood down, separates the cells that we want to collect, the stem cells, along with some other cells, and then returns the rest of the blood back to you from the other arm. And this process goes on for about 4 to 6 hours. And in that time, we can collect adequate number of cells. Now, for younger patients who may not have big veins in their arms, they may sometimes need a temporary central line. So they may need a line to be put in their neck, which goes and sits close to their heart. And instead of putting two IVs, one in each arm, we use this line to connect them to a machine. So that may be an additional procedure for some younger donors or those who don't have good veins that can be accessed with a large IV.
I will share that going through a bone marrow aspiration was the worst thing I've ever done in my life. And I remember that day vividly because my screams echoed through the hall. I don't respond well to lidocaine. And even after like 2 to 3 doses of lidocaine, I felt every pull as a patient. And I can't remember why my provider was so against putting me to sleep. I think there were other things they were concerned about. But I know as we were preparing for my process, I recall this very vividly. 2 of my brother's closest friends were like, do you really want to do this? Because the assumption was not apheresis. The assumption was, you would wake up and they would have put a needle. And so for him, there were moments where I could sense the fear, but he was trying to kind of power through it so that his fear doesn't become my fear as his sibling. So really detailing that process is appreciative because I always urge people within my family and in my culture, being Nigerian, most people don't think to even sign up to be a part of a registry because the assumption is, I don't know what they're going to do with my blood. Like, they just have these like wild assumptions, which isn't the reality culturally. But I think that's also because of misinformation and an overall lack of education. But in touching on apheresis and bone marrow aspiration, what if a donor and the recipient have different blood groups? Because I know for me, I vividly remember my provider saying, we need to confirm that they have the same blood groups. And I couldn't quite understand why. He's a guy, I'm a woman. If we are full match, then what role does blood group play in this process? So can you shed light on why it's important to know the donor and the recipient's blood group, especially if they're different sexes?
Yeah. So blood group sort of is expressed slightly differently from the HLA genes. And so while HLA genes are the identity card that our immune cells sort of use to recognize which cells belong to you and which cells belong to somebody else, blood group is a completely different system of identification. And for whatever reason, nature has come up with these multiple identification systems. And so one of the things that we can transplant patients who have different blood groups from their donor. It's not a problem. But there are certain other complications that we have to keep in mind when we do that. And one of the things that we do to reduce those risk of complications is if you have a donor whose blood group doesn't match with you, we have to red blood cell deplete the graft. So we have to take the graft that we collected and we have to put it through a filter, get rid of the red blood cells so that we don't give you too many red blood cells that have a different blood group than you. Because if we did that, you can end up having a transfusion reaction. And so that's why we need to confirm what the blood groups are. And if they are different, then we have to do some sort of red blood cell removal process.
And just for clarification, blood group is like when someone tells you I'm O positive,
correct,
that's blood group. Okay.
Yeah. And also, interesting tidbit, your blood group changes to that of your donor after transplant. And so let's say you were A positive to begin with, and you got transplanted from somebody who's B positive. A couple of months after transplant, your blood group will be B positive.
Wow. I did not know that. I am today years old and I'm 3 years post-transplant learning that's possible. And it just so happens that my brother and I were the same blood type. So we never had to talk about this, but wow, I love these fun little facts. And I'm curious. I remember my doctors talking about Carl being male and me being female, and I don't remember, is there something they have to do? Like for the different blood groups, they have to red blood cell the graft, but is there anything we have to do if your donor and recipient are the different sexes?
No, as long as you're an HLA match, that's all we care about. Blood cells work the same in men and women. The only difference is women who have had multiple pregnancies, they may have been exposed to different antigens from the developing fetus. And so there is an increased risk of graft versus host disease to the recipient if you receive stem cells along with T cells from a donor, from a female donor who has had multiple pregnancies before. So that's the only consideration there. But once you get the cells, they behave the same.
Okay. To tell you that I'm giddy will be minimizing how I feel right now, because this is not only fun for my brain to explore, but I think for patients and caregivers in the sickle cell community, this is informational and educational, because the human body is a miracle in itself. To know that there's so many like complexities with if you've had a child before and how that can impact the recipient is blowing my mind at this moment. Now I want to touch on the potential risks for donors. My brother was incredibly altruistic and kind. Prior to the process, he stopped red meat, he stopped drinking alcohol, because in his mind, he said, I'm going to give you some top shelf stem cells here. I don't know if that impacted my process, but we'll go along, because whatever it was we were going to do to make him feel better, we were going to do that. Can you shed light to some of the potential risks for donors when you're like, put me on the registry? What really are you signing up for, and what should you be concerned about?
Yeah. So donors go through a lot, and yeah, it's definitely their love for you, which is why they do that. So sometimes we have to mobilize the donors, like I said. And so mobilization of donors involves giving them an injection every day for about 5 to 6 days. So it's an injection that's given under the skin, and it causes your stem cells to come out of the bone marrow into the blood, or it causes them to multiply and become a lot of stem cells. That injection, it can make you feel like you have the flu, because these bone marrow stem cells are multiplying, they're coming out, they're active, they're revved up. It causes bone pain, it causes pain in your long bones, in your legs, in your arms, in your back. And that tends to get worse as days go by. So the first day you get your injection, you're probably going to be like, meh. But the second, third, fourth, fifth day, and definitely by the day you are getting to collection, you're feeling it. And so that's definitely one of the effects that we see with the injections that we give to prepare a donor. Now, if somebody were to undergo a bone marrow harvest, like I described to you, it involves a lot of needles going into your bones. And I've had a single bone marrow aspirate done on myself, so I know how it feels. And even just one aspirate where, you go in and put one needle in and suck one tube out, and that's it. That's pretty painful. But Wunmi, like you described, you probably had an harvest to collect a backup before you underwent transplant. That's pretty much collecting a lot of bone marrow. And so that involves several needles going into the bone. That is a painful process, and that bone will then take a couple of days or weeks to heal. And so during that time, you may continue to have a lot of pain in your back, in your hip bone. Many patients may need to take pain medications for an extended period because of that. Now, patients who have undergone an apheresis, they may still need to undergo the mobilization, the part where they receive injections to get the stem cells out into their peripheral blood. And then, like I said, some patients may need to get a line placed in their neck. And that line can also be uncomfortable, or at least cause some discomfort even after it's been taken out for a few weeks. It may be sore in your neck. You may not be able to move your neck easily because of the pain that you feel over there. So it is an uncomfortable, it may be a painful process. I will say though, with all the developments in the field that we have gone through over the last many years, we've tried to make sure that this process is as safe as possible for our donors. And the chances that a donor will have a major health issue because of their donation is very, very, very low. We are extremely careful, and all transplanters are extremely protective of the donors. Like I said in the beginning, they will undergo a rigorous health examination to make sure that the donors are it is safe for them to donate in the first place. And if for whatever reason we don't feel that it is safe for that donor to donate, we will not proceed with that collection.
So, Dr. Sharma, I have one more question before we move on to the next section. And you had previously mentioned like pregnancy, CMV. I'm wondering if, let's say my brother, let's say he's a perfect match. Is there anything, any health issue that would be flagged in my brother that would make him completely ineligible or inappropriate for him to be a donor, even though we're a perfect match?
Yeah. So there are a number of health conditions that can preclude a donor from potentially donating. And it's not an exhaustive list, so I will encourage whoever is thinking to be a donor to go and talk to their physician. But generally things like, if they've had some sort of a cancer before, that even if they've received treatment for that, they may not be able to be a donor after that. If they have uncontrolled diabetes or uncontrolled hypertension, which could again make the collection process dangerous for them, they may not be able to donate after that. If you're currently pregnant or breastfeeding, again, you may not be able to donate while you're pregnant or breastfeeding. So these are some health conditions, other things like autoimmune diseases, infections. Of course, if somebody has a blood-borne communicable disease like HIV, or syphilis, we would not want to collect from that donor as well. And so there can be multiple health conditions that could, even if you're a match, that you would not be able to donate. And certainly this is not a complete list, but there are things like this that can affect.
I want to ask about long-term follow-up and long-term effects, because as a post-transplant recipient, my follow-up care from the NIH was 5 years. And then obviously as time is passing, I'm not required to see them all the time. Is there any long-term follow-up for donors, specifically donors who have been pregnant before or young donors who are under the age of 5? Because at the moment, I know 2 families who are currently going through a stem cell transplant process. One of them, her child is, I think, 6 or 7, and the donor is a year old or like 18 months. Is there any follow-up care for those types of donors?
Yeah, every transplant center has their own policies regarding that. And generally speaking, we follow up with all of our donors the following week to make sure that they're doing fine. The good thing about stem cells is you make more of those every day. So it's not like a kidney donation where if you give 1 kidney, you're only left with 1. If you give 1 million stem cells, you're going to make 1 million stem cells in the next week or so. So that in that sense, stem cell donation is a little bit different from other kinds of tissue donation because you will regenerate. And the good part is younger donors are much better at regenerating than some of the older folks like you and me are. I certainly am old. You're probably not as old, but if I were to be a stem cell donor today, I think I'm going to have a hard time. I'm going to be like your brother, limping around for quite some time because of the pain, and my stem cells will probably take longer to regenerate than anybody younger. But the younger donors, they do fantastic. They can regenerate very quickly. I've seen little kids, 2, 3 years old, where we have just done our bone marrow harvest in the morning. And in the afternoon, I see that kid running around the hallway. And I'm like, where do you get that energy from? What did you eat today? So younger donors actually tolerate the procedure much better. And so we follow up with all our donors the following week to make sure that they're doing fine. There are really no long-term consequences or harmful effects to donors from a stem cell donation.
I asked that question because I really think it's important that primarily people of color sign up to be a part of bone marrow registries. I want to reassure the community that although it's a journey in itself, it's only for a short period of time, which is at the pre-transplant stage. Post, you'll bounce back, your body will rebuild itself again and all will be well. I know patients within the space, especially when you work in patient advocacy, who had donors and then the donors backed out. And, the disappointment that comes from having light at the end of the tunnel, but it's immediately turned off, is a level of grief and trauma like no other. Because again, we know sickle cell is a debilitating blood disease. And as you age, it can become a bit more complicated. And so I really want to urge the global community, specifically in countries like my home country of Nigeria, where 1 in 4 people have traits. So please, if you go on vacation to the UK, Like Dr. Sharma said, it's a mouth swab or a blood draw. You give the gift. I know in the explanation, it's a rigorous process, but really think about the improvement to someone's quality of life. It's a gift that you never stop relishing in your ability to change the trajectory of someone else's life. So, Dr. Sharma, is there anything you'd like to add for communities of color to really stress a call to action of like, we need to participate in bone marrow registries?
Absolutely. I think, the more donors we have in the registry, the more are the chances that somebody who is in need will find a donor that is a good match to them. So if you are young and able, go ahead and sign up to be part of the registry so that when somebody is really looking for that one ray of hope, that you are that ray of hope for them. But at the same time, I would also say we have made tremendous improvements now in using half match or mismatch donors because of all the clinical research that has been going on in this field over the last 15-20 years. And so clinical research really is the pillar upon which we build better therapies for patients, about better treatments for patients. So if you ever have a chance to participate in a clinical research study, I would urge you to go say, yes, please sign me up, because that clinical research study may or may not help you. We certainly try that anytime we are doing research that it helps the person who's participating in the research. But even if it doesn't help you, it will help generate data that will help somebody else down the line. What we learn from these clinical research studies is just enormous. And that's how we've made progress today. Come such a long way from when the first antibiotics were discovered. We can do all these complicated transplants these days. The future, we don't even know what we might be able to do. And the only way we will figure that out is by conducting medical research. So if you have a chance to participate in a research study, please do.
So we're going to move on over to our rapid fire round where we ask you questions, and you only have, because we're such generous ladies, we're giving you 2 seconds to answer, just from the kindness of our heart. So you don't have time to think. The minute we ask the question, we need an answer spontaneously. And I love this part of the show because it helps us peel back the layers to, you are Dr. Sharma to the community. I would like to know a little bit about Akshay now. What makes him tick? What makes him unique? And what is his why of wanting to work in this space? So I'll start with the first question, which is, what is the most rewarding part of your job?
The hugs that I get from my patients.
Oh. That's such a sweet response. Why am I like, my heart was just like, of that response.
You only gave me 2 seconds, so I didn't have much time to think.
That's a great answer. And nothing beats a hug from a kid. Oh my gosh. Nothing, nothing, nothing. Okay, next question. What is one thing that always makes you smile no matter how bad the day has been?
When my patients come back many years later and tell me stories about their high school graduations or their upcoming vacation or wedding or a child they're having, that's the best thing I can have.
It's the icing on the cake because, to me, I sometimes synonymize providers and teachers. Teachers see you in your formative years, and when they get to see where you've been able to elevate and take your life in that direction, it's just the most rewarding aspect of the job because it is an act of service. What is one thing that makes you smile no matter how bad your day is?
There are a lot of things for me when I come at work, the hugs from the patients who come back and tell me how happy they are. These are things, I love for doing what I do. And I do that despite the fact that it is such a hard job to do, going through transplants every day. There is light at the end of the day. And that's what keeps me going and keeps me smiling.
Okay, this next one is a funny one. And I'm always curious to hear what our guests have to say. What is your weirdest food combination?
I can mix all sorts of ice cream together and I can eat that. I have a giant sweet tooth and it doesn't matter what flavor it is. I like to taste all of them and I can literally just mix all of them together and have them.
I love that answer because you're just kind of like, look, I have a sweet tooth. Give it pistachio, I want it. Wild cherry, bring it on. Strawberry sorbet, bring that on too. Let's all mix it in a pot and then it's still going to be delicious because I get to have a taste of everything. Now,
add some chocolate syrup on top too.
Now, that's when you know you really have a sweet tooth. Now, if you were an element on the periodic table, what element would you be and why?
Hydrogen.
Why?
Well, I have a one-track mind. That's sort of I think about. And hydrogen has just one proton, just one thing that the element does. So that's what I'll be.
This has been awesome, Dr. Sharma. Thank you so much for talking to us today, for explaining in a way that even someone who isn't impacted by sickle cell disease, but is curious as to the donor process, can walk away learning a thing or two about cell and gene-based therapies and the work that you're doing in this space. I am incredibly grateful to have you on the show. I cannot wait to continue to see your career trajectory, but more importantly, I can't wait to collaborate with you because I think it's so quintessential for us to foster a collaborative environment between patients and providers where we're leaving our egos at the door, but we're coming to learn a thing or two about each of our experiences and working collectively and as a group to make sure that we are really driving impact and affecting social change in the sickle cell space.
Thank you so much for having me on the show and talk about a topic that's so near and dear to my heart. And I look forward to continue working with both of you.
Sickle Cell family, as you can tell, we both everyone on this call enjoyed the recording session. So be sure to listen to this podcast wherever you get audiovisual content, whether it's Spotify, Apple Music, YouTube, Audible, you name it, we are there. Keep coming back if you have any more questions. Be sure to stay engaged with us on our media platforms at Through the Genes. Thanks, Sickle fam. Until next time, we are signing off.
Bye, family. Another powerful episode with Dr. Akshay Sharma. In continuing the conversation around the donor role in transformative therapies, we'd like to welcome our special guest, Dapo Bakare, who is the older brother and donor of our host, Wunmi Bakare. Enjoy the episode. Hey everyone, welcome back. I would like to welcome to the show my older brother and my only brother, Dapo Bakare. Welcome to the show.
Hey everyone, nice to be here.
If you are curious about the process of stem cell donation, then this is the episode for you. When I called to tell you the news that you were a match, how did you feel?
Just like I feel right now, lost for words. I think it was just all of a sudden. I still was recovering from the fact that there was a cure. I was still recovering that was an option. And then to hear that, it was surreal. I still remember it quite vividly. I was driving home when you called me to ask me about it. And I was on the road. Someone had just cut me off. Hey, look what I do now. I was like, what? Oh, wait, what? But I was filled with so much joy. I was just still speechless, same way I am speechless. There's nothing to put the words that can capture that feeling of being able to be there for someone you really care about.
So, Daps, I'm actually so excited to interview you because I have my own transplant process. My brother was also my donor. And so I know his perspective, but I'm actually very curious to hear other donors' perspective and how other sibling duos navigated the transplant journey. So I wanted to ask you, when Wunmi came to you about the HLA screening and possibly donating your stem cells, how did you feel and what was the first thing that came to your mind at the time?
To be frank, does it hurt? Was the first question that
That's
came
real.
to mind. Because you hear a lot of these stories about what that involved in the screening process and what that would be and feel like and all of that. So that was the first thought that popped into my mind. And the next that was on my mind was just, when can we do it? What's the scheduling like? What does that look like in terms of all the logistics to get it going? I didn't know much. I intentionally don't look a lot into sickle cell because when I last looked, it was just kind of seemed dire. And so when I heard the HLA screen, I didn't know much about what it would be. I just was like, oh, sure. Then I had to start going back and researching it, figuring it out. And then, the dumb thing you shouldn't do, which I did, was tell a friend of mine. And he's like, oh my God, that thing is going to hurt. It's going to be crazy. So advice to anyone out there, just look it up online, talk to your doctor and get a better perspective of what it is. Because whether it's friends or some messy part of the internet can give you bad feedback into what you need to do or how you need to prepare. So talking to my doc, I think shortly after I had an annual checkup and I talked to my doc and he basically broke everything down. It made it more clear, gave me some understanding of what will entail. I felt good. I felt great that there was opportunity here, and I was nervous about what was going to happen.
I appreciate the fact that you said you were nervous, because the reality is, I don't think I've ever shared this with you, is I was more afraid for you than I was myself in those moments, especially when you navigate a complex chronic illness like sickle cell disease. You know what that pain feels like. And I don't wish that for anyone. And so even from what I knew of the bone marrow transplant process, my fear and my worry was, I don't want to do anything that will impose the pain I remotely experience on someone I love. So you sharing that you were nervous, I think I was more nervous for you, but at the same time, this was my only way out. And Christelle, you know this, but I'll share it again for newer folks that are listening to our show, is that I found out my brother was a match a few days to my 30th birthday. And in my prayer to God, I had always said, God, I don't want to live past 30 with sickle cell. So if I needed a sign, that was a big neon sign of God saying, your miracle has had a front row view to some of your most crippling vaso-occlusive crisis episodes. And so it was fitting that the person who had lived life with me, who had been on vacations where Wunmi has to go to the ER and everybody else is trying to get through the trip, was the one that had the ability, without no one in the family knowing, to be my cure. I will say this selfishly, I'm going to admit that, is I wouldn't have wanted anyone else. It's the honest truth. I was glad it was my brother and that I didn't have to go through the bone marrow registry and try to find a donor somewhere in the world. This was someone I knew. This was someone that knew me. And this would be something that I knew the right person was beside me to hold my hand in moments of uncertainty. And so having my brother as my donor was a huge blessing. I say not just for us as siblings, but for our incredible family dynamic. I think sometimes in families you have good things, you have bad things, and sometimes they can bring you closer or push you farther apart. And I feel like going through that process definitely brought us together. But I want to ask, Dops, because a lot of what you went through, I unfortunately couldn't be there during the apheresis process and your evaluation process because of, visa issues. Can you explain what was the most challenging part of that experience for you?
I think for me, the process, the folks at NIH made the process at the beginning, really smooth in terms of telling me what was going to happen. But before I even get into that, I think the first key thing I had to do was have a conversation with my wife. We had been planning to have a kid. We were just kind of, just got married, and we're basically trying to figure out, key things along the way and first year of marriage. So for all those who have been married, that first year of marriage can be awesome bliss or kind of, oh my God, what can this be? So that was first stage, so kind of figuring that out and figuring out how I could take time away. The second thing, as I was running my own company at the time, and so it was, how was I going to take time off work to actually go and do this, and how would I get things managed at that time? The third thing was, and probably the most important thing, was just the fear of the unknown. I didn't know what it was going to be like when I got there, even though they had calmed me down about it wouldn't, would be a painful thing. That still sat at the back of my neck, just gnawing at me. Got there, navigated my way to the NIH. It was fantastic. They met me, they were really gracious. It was a lot of walking up and down to find the right place to go to and navigating all that. And test here, go up to this room, go test here, to this room there, test here, test here. I mean, I gave my blood so many times, I was like, I should get a cookie or something for all this blood I've been giving. Then came the day of the actual procedure itself. I was still nervous, but the doctor and the advisor, Nona, was guiding me through the whole thing. I think the part that I was kind of worried about was just like, how am I going to basically stay still on the bed for I believe they quoted something like 7 to 8 hours, just lying down still. You can't pee, you can't do anything. You just have to just lie down there. And they just plug something in one arm, plug another arm, and you're just there, not moving and just waiting for hours on end. That, kind of you're a bit restless and nervous. I seen the machine next to you just kind of going vroom, and just sucking it out and putting it back in. And part of you is kind of freaked out, I know I said nothing's going to happen, but that sound, the stuff coming out of me, still freaks you out. But one of the things they do beforehand to get the process really going well is they give you some medications that basically allow you to produce a lot more stem cells than you normally would. Side effect of that was you have a bit of a backache, lower back ache. It's not, too painful, but it's just kind of just there, right? There, just gnawing at you a bit. So I'm sitting there, still have a bit of that pain, that back pain, and then this machine is going on, and what are you gonna do? So one thing they do allow you to do is they actually have a movie, and the movie I think I chose The Avengers. I was like, while I'm doing this, I might as well feel like a superhero and watch a superhero movie. So I played The Avengers for like however many episodes, because I figured that was long enough to like cover the whole process. Luckily for me, it didn't take up to 7 hours. In fact, it took 5 hours or so. So it was much quicker than expected. And they're like, it's good, it looks solid. I was like, all right, I got the top quality stem cell there. So I got my kudos. Still no cookie. I'm still upset they don't still give me a cookie. But they give you little snacks and stuff. But then the next morning, I had a weird feeling in my leg, just an aching pain up and down my leg. And that really freaked me out. That scared the crap out of me. Oh, and there's something I didn't mention before. When I did my first screening, another scary thing happened on the last day, which was the doc called me to tell me, hey, you might want to go check something out because you might be at risk for cancer. So I had at the back of my mind that fear of that happening then, and then the fear of this. And so it left me with a what the hell is this? There are two sides to that: physical, kind of medical, long-term effect, and then mental effects. So the first one, physical, medical, any effects, I haven't had anything. Doctor always comes in, clean bill of health, nothing to worry about. However, I am still mentally a bit worried about the effects, and it's probably just psychological. It's you kind of feel like stem cells are there, and so if you've given some stem cells, whatever time you had has just been chopped off a little bit, and so that's where it has no base on anything whatsoever. It's just the thing that rubbed by my mind. So after that procedure, I decided to give up red meat because I was like, let me stop something so at least it can help my body be better. And also the cancer scare did not help make that better. So I was like, red meat, just cancel that. Let's just do that. That didn't last very long. I think it lasted like maybe a few months. And I was like, yeah, I'm hungry. And I went back to my carnivorous ways. But that's just to say that there were a couple of things that it made me kind of start to pay attention to my health a lot more, because I just felt like, I just needed to take care of it a bit more, from the feeling I had afterwards to just the feeling that, I want my new stem cells that come out to be a better stem cells that can keep me going for, as my old age, and being able to play with my kids and their grandkids. And so that mentally has always, it's still at the back of my head, gnawing at me. It's just, is there some effect that it's having? I need to probably take care of myself a little better.
That's really interesting that you share that concern. And I realize I've never asked my brother if he is still worried about things post-transplant. And so thank you for your honesty and sharing that. This brings up a question that is not on our list. What support do you wish you had during the process? Or is there any way you could feel reassured? Like, what would actually get that lingering worry in the back of your mind? What would actually ease that? And how can the medical team or other resources, how can you be better supported in that journey of you processing what your concerns are?
This is very, very peculiar to me. I'm a bit of a person that whenever something bad happens, I kind of eat that bad thing in my side corner by myself. I don't usually share. So me calling my cousins kind of weird. To show you how dire it was. It's just, I would just kind of sit back in my own place and just chew that bad thing on the side. This is why I appreciate what you guys are doing, because I'm the sort of person that like to just be aware of these things going on. So mentally I can know, okay, that's what's happening. I like to know all the risks. I'll still say yes and still jump headfirst into it, but at least I want to know this pool has sharks. Okay, I'm still going to dive into it, but at least I know the shark is there. And, I might wear a metal vest or something as I dive in, but I'm still going to dive in, right? So it's good to know. I wish there were just more ways to get stories of everyone's experiences, because not everyone's experience is going to be the same, and not everyone's personality is going to resonate with you, and being able to find multiple people, because then you'll be able to find, I think I resonate with him on this area, but I resonate with that other guy on that thing. So having as much information and stories about others would be fantastic, because I can just be on YouTube watching a video of someone else and what their experience was, for us to do this again.
It's crazy because when we were creating season 2, we were purging on the episodes and rating them in other of like, we have to talk about this versus maybe we save this for season 3. The role of donors was a big one, but then we also have another episode is the importance of support systems during this process. Because, and you know, I say this a lot, mental and physical go hand in hand. COVID showed everyone, regardless of race, ethnicity, creed, that the mind-body connection are vital. And so I do agree that in talking about support and how the healthcare system can better support donors, it needs to be a 2-part process. It needs to be on the mental side and on the physical side. And it's not necessarily saying you have to get on a call and talk to a therapist, but it's being able to unpack those fears with someone who won't mirror back to you judgment or mirror back to you fear that could make your own fear grow mightier than it actually is. And I really do think that I was very excited when Dr. Sharma was talking about for pediatric patients is different because they really support the donor. Because sometimes the donor can be an older sibling, and in some cases, the donor is a much, much younger sibling who doesn't even have the awareness that they're about to embark on this thing for their older sibling. But I think that needs to be across the board going forward. As we discuss these novel therapies, you know, gene therapy, yes, we recognize that with gene therapy, you don't need a donor. They're harvesting their own stem cells and then editing them in a lab. But the reality is sickle cell doesn't impact the individual. It impacts their entire family unit. Before we say our goodbyes, I wanted to take an opportunity to say a huge shout out to the team at the NIH for taking care of me and my brother so well. We appreciate you. We love you. Shout out to Dr. Shay and Nona, Christina, everyone on my team. You guys did a fantastic job. And I thank you for all of the lives that you're changing by the program. You are really, really giving us a new lease on life, and we're so grateful. Christelle, any final thoughts?
My heart is just very warm. And I called Carl earlier and he didn't answer, but we love him. And I'm actually going to call him after this so I can kiki and remind him how much I am grateful for him. So thank you so much, Daps, for giving us such a heartfelt episode. I love the Bakare siblings on this episode. This actually has warmed my heart more than I ever could have imagined. And so I'm just, and you know, next time maybe we'll get Carl on here. It could be a little sibling duo. But yeah, thanks so much, Daps, for coming on. Please, I hope this is not the last. For those of you who are listening, you can catch us, as always, on Spotify, Apple Music, YouTube, Audible, you name it. We are there. So be sure to stay in touch with us, ask us your questions, and stay engaged on our social media profiles at Through the Genes. So thanks for listening, and until next time, we're signing out.
Bye! This show is brought to you by Beam Therapeutics, Synthigo, and Kamal Therapeutics, with support from the UCSF Sickle Cell Center of Excellence, Through the Pain Inc., and Sickle Cell Prodigy.